Hello, this presentation was prepared by Saloni Maninder as part of the requirements of HAP 725 course in the Health Informatics program at George Mason University. The case study analysis in this presentation is to compare the performance of University of Virginia Medical Center based on heart attack patients to that of its competitors in Virginia. The source of data used in this case study analysis is based on the dataset available at the Centers for Medicare and Medicaid Services Hospital Compare site. The files downloaded contained data that were available from 2013 to 2017. For this case study, it is important to note that the analysis is limited in several ways. First, data were not available for all years. It is possible that if more data were to become available, the results could change. Second, the control limits were performed at a 95% confidence interval, meaning that in 100 observations, we can expect that 5% of the data will randomly fall outside the control limits. Lastly, the study focused on only 5 quality measures. It is possible that conclusions could have been different if other measures were to be selected. This case study assessed the performance of University of Virginia Medical Center to 3 of its competitors in Virginia, which include Medical College of Virginia Hospitals, also known as VCU, Inova Fairfax Hospital, and Sentara Norfolk General Hospital. To compare the University of Virginia Medical Center to its competitors, a total of 5 quality measures were selected in respect to acute myocardial infarction or heart attack, which is prevalent among patients in hospitals. Specifically, measures include AMI 30-day mortality rate, AMI 30-day readmission rate, excess days in acute care after hospitalization for AMI, risk standardized payments associated with a 30-day episode of care for AMI, and lastly, overall hospital rating. The first quality measure is AMI 30-day mortality rate. Overall, University of Virginia Medical Center AMI mortality rate is within the control limits for all time periods compared to its competitors. The second quality measure is the AMI 30-day readmission rate. In 2013, University of Virginia Medical Center's readmission rate exceeded the upper control limit. This means that the hospital had more than expected rate of unplanned readmissions for AMI. Based on the graph, between 2014 to 2017, they were within the control limits. The third quality measure is the AMI 30-day access days in acute care after hospitalization. In this graph, the University of Virginia Medical Center's access days in acute care, or EDAC measure, was not within the lower control limit in 2015 and 2017. Here, it is important to note that a negative EDAC indicates that a hospital's patients spent fewer days in acute care than expected during the 30 days following hospitalization. This means that the University of Virginia Medical Center had heart attack patients that spent fewer days in acute care than its competitors. Overall, in 2013, 2014, and 2016, the hospital was within the control limit compared to its competitors. The fourth quality measure is the 30-day payment for heart attack patients. In the graph, it is shown that over the years, there has been a significant increase with risk standardized payments associated with a 30-day episode of care for AMI. However, University of Virginia Medical Center was within the upper and lower control limits for all time periods compared to its competitors. The fifth quality measure is overall hospital rating. On the x-axis, this chart shows the years in which the data on hospital scores were available. On the y-axis, it shows the overall hospital rating. Overall, University of Virginia Medical Center's hospital rating is within the upper and lower control limits. As you can see on the graph, there is a slight increase starting in 2016. This means that the hospital is continuing to perform well. In summary, University of Virginia Medical Center is performing same as its competitors for mortality rate, readmission rate, and overall hospital rating. Additionally, over the span of 5 years, there is an increase in risk standardized payments associated with a 30-day episode of care for patients with heart attack. Although the hospital is within the control limits, if the trend continues to increase, it appears that they will exceed the upper control limit. Finally, the University of Virginia Medical Center performed better than its competitors in 2015 and 2017 for 30-day access days in acute care. If the hospital continues to perform well, they will see a decline in patients spending access days in acute care. This brings us to a conclusion to my case study analysis. Thank you for watching this presentation.